Losing 70% of my vision to glaucoma was scary, but if I knew there were going to be two different types of surgeries that could help change my vision, I would have done so. But today, I want to give you my knowledge and my tips and advice on what these surgeries are and how beneficial they can be for you and my personal experience and what I learned. So let's dive right in. So, with an overview of what glaucoma is where your ocular pressure in your eye starts to go up, your aqueous humor that starts to build a fluid. So, think about it in a way of metaphorically, you have a sink and the water starts rising up, and there's just no escape. It just keeps on going, and it just starts to build so much pressure there. And another metaphor way to explain it is you have a tire and the pressure starts to go so high. Say you can have almost 33 PS or 40 PSI. It just keeps on going higher and you can feel this massive explosion or something amping. And you have to find a way for it to release. That is going to be your aqueous humor having so much liquid form and you want to find a way to release it. That is what an overview of what glaucoma is. And we're just going to really talk about your aqueous humor and how we can really release the fluid and how we can get your pressure down, your ocular pressure. So these two types of surgeries or treatments are really going to be your minimal invasive. And the second one is going to be your traditional surgeries. So let's start off with the minimal invasive surgeries. When it comes to minimal invasive surgeries, you can think of it as you already had surgery to your eye, and the glaucoma doctor, the surgeon, the specialist, they're just gonna work on the current drain that's already on your eye or in your eye to make it work better or perform better because the current drain that's already in your aqueous humor is not working or is blocked. So, say you have a drain, for example, and it's already packed up and built with so much food and it's clogged and you're trying to pour a drain or something down there just to unclog it. So think of that as a minimal invasive. That's what the glaucoma specialist, the surgeon goes in and do. They're trying to fix the current drain, the current shunt or current thing that's in your eye to make it better or perform more suitable for you because the current condition of that drain is not working. So that's where they have to fix it. And usually with minimal invasive, you don't have to really go back into the operating room. You can get it done in the clinic still. You don't have to go to the outpatient clinic, which is pretty beneficial. And recovery time is going to be a lot quicker. And with the minimal invasive surgeries, you're going to have a more shorter, and this is more targeted to people with mild to moderate cases of ocular pressure. So this is treatment you go for, and you can have a stent placed. You can have anything done to your current drain that you have in the aqueous humor. So with the next surgery that we're moving on is going to be your surgery. Your traditional surgery is going to be your shunt, your trabeculectomy, and that's where you put a flap over your eye to help drain it. It's where they cut and put a flap there, almost like a trap door. Think of it like a trap door in a way to explain it because with a trabeculectomy, they can have more ways to fix it post-treatment and post-surgery because they can either cut the stitching more to make it more flush out more to reduce your pressure. So that's the beneficial of the traditional and the trabeculectomy. And what I personally have is going to be the shunt. I have the Optima shunt, which I was given because I have steroid-induced glaucoma. So each person is different depending on case by case scenario. So you can get a shunt, you can get trabeculectomy, or you can get a minimal invasive procedure. But just know a traditional surgery method, the recovery time is going to take the longest. Side effect is going to be higher risk because you're getting basically a whole new drain or whole new thing on your eye rather than fixing what you currently have. And there's just a lot more to it than with a minimal invasive surgery. So you have to look at the outcomes for both ways. If your pressure is too high and it's at over 40, 50, 60, then sometimes a doctor could recommend a more traditional route and be able to fix it. But with the downside, I do want to mention when it comes to the trabeculectomy is that you can actually recover too well. Some people have a very good recovery ability where you start to scar and you have healing tissue over that flap, and they have to go through treatment again and surgery again to fix it. So that's another thing. That's why they give you medication for post scarring and anti-inflammation and steroid drugs with your eye drops. So just know, depending on your body, how you react. So I know you could feel a little worried and say, "Oh, the trabeculectomy didn't work or the shunt didn't work." It can work. It just depends how your body reacts, because sometimes your body just recovers too well and you start to scar over it. And instead of scarring little, you scar over. So that's just one thing it is. It's just like getting a kidney transplant like me. My body rejected it immediately. Your body just wants to repair it so fast. That's why it's a harsh thing to go through, and the recovery process will be long. And sometimes it's not the most best treatment, but it's also a good treatment as well. Me personally, would I go through another shunt surgery? Yes. Just because my recovery time, I would say, is about 6 to 8 weeks. My scarring wasn't too bad, but everything else was pretty well. And the draining still goes there. I have 2 shunts in my eye. So when selecting both surgeries, just make sure you're looking at the pros and cons of each side, the recovery time on each side. As I said, minimal recovery time, shorter. Traditional recovery is going to be longer. And when it comes to side effects and risk involves, minimal, less risky, traditional, more risky. And who's a candidate for minimal is always going to be the one with mild to moderate cases of ocular hypertension and high OIOP. And the people with traditional cases are going to be the ones with very severe cases or moderate cases, because mild cases, because you want to reduce it. And sometimes the traditional route can really drop your pressure immediately. And that's where you can get cut back on some of the eye drops. So it's important to look at both scenarios, which one is best for you. So that's just what I've done and what I learned from both sides. So if you found this video helpful and are in the process of going through surgery or in the process of talking with your doctor about which one is good for you, let me know what is working for you in the comments down below, because I would like to learn more. And I do have other videos in mind. I'll talk about laser treatments as well, because it's important to understand what kind of treatments you can get. So if you enjoyed this video, drop a like down below and subscribe for more information. Thank you.